Hello friends. When it comes to remedies for treating constipation in kids, I feel like this is a topic that comes up on a weekly basis in my pediatric practice, and I get it. From picky eaters to feisty toddlers to busy schedules, there are plenty of reasons that make having regular bowel movements hard for kids. However, you may find yourself in this situation where your child's constipated. In this video, I'm going to rate the most common over-the-counter constipation relief aids for kids. What exactly do they do, and any drawbacks you should be aware of? Just a note, this information is not meant to substitute for a doctor's visit or a diagnosis, but to help bring awareness to the products at your disposal and my personal opinion on what works and what doesn't work for having treated kids with constipation for over 18 years of experience. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered, integrative approach to solve their children's health issues. So, if that sounds like you, make sure to subscribe to the channel for more content just like this. First, before we get into it, a quick note about what constipation actually is. Like, how do you know when your child is experiencing constipation? Well, constipation usually is diagnosed by symptoms clinically, which include hard, dry stools that are difficult to pass, bowel movements maybe less than 3 times a week, stomach pain or pain during a bowel movement, liquid or poop smears on your child's underwear, avoidance of bowel movements for fear of pain, and blood on the stool surface. Over-the-counter products can overlap in their mechanisms of action, so knowing generally how each of them work can help you determine which class of medication works best for your child. Number 1, lubricant laxatives. These work by coating the stool to make it more slippery and easier to pass. Type 2, osmotic laxative. These basically draw in water into the intestine to soften the stools that's been sitting there and it's been dried out, and so therefore allowing for easier passage. Type 3, stimulant laxative. Now, these stimulate the rectal muscles that help them propel and push the stool out. And type 4 is stool softeners, and these mainly work by also adding moisture to the stool, therefore allowing strain-free bowel movements. Now let's get to the part we've all been waiting for, rating the most common over-the-counter constipation relief medications out there on a scale of 1 to 10, 10 being the highest. I'm basing my ratings on how effective they are at resolving the constipation, mostly temporary relief, and also in consideration of the side effects like discomfort and dependency. One major disclaimer here is that all these medications are not meant for chronic use, nor is it safe to use chronically like daily or several weeks' time. Let's begin with Miralax. This is an osmotic agent that draws water into the intestine to allow for easier passage of stool and is most recommended agent for chronic constipation by most pediatric gastroenterologists. But I personally rate this as a 5 out of 10 because it doesn't resolve constipation right away, and your child might need to stay on it unless the root problem of constipation is addressed. Miralax does draw fluids into the large intestine, therefore making stools softer. Milk of magnesia or magnesium hydroxide, also an osmotic agent, so it takes about 8 to 12 hours to work. And kids with a history of kidney disease should use cautiously because it is renally cleared. I would rate this 6 out of 10. It definitely will help your child to have a bowel movement within 24 hours of use, but it can, when given too much, cause a sense of urgency and pressure and discomfort when your child is having a bowel movement. Number 3, Colace. This is oral stool softener. This can be taken as a pill or chewable forms like gummies, but I rate this 2 out of 10 because it doesn't always work. It can take days before you see an effect. Glycerin suppository is a osmotic laxative and it irritates rectal muscles. So it works within minutes. Yes, minutes. And this is the one option that I will recommend to families if their child is visibly in pain and inconsolable because it will provide the quickest relief. My go-to brand is Pedilax, which comes in small suppositories for ease of use. Now, I rate this 9 out of 10 because it definitely works, but you do not want to use the glycerin suppository daily. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Senna is an oral stimulant laxative. It works within 12 to 24 hours by stimulating the intestinal musculature to squeeze and push to retain stool out. I rate this 7 out of 10 because it works, but it does cause some discomfort as a stimulant, causing the muscles contract. So you may experience some cramping. Mineral oil is a lubricant laxative. This is an old school pediatric remedy. It is no longer super popular, but for some kids, it can help stool passage, rated 2 out of 10. Lastly, Dopalax or bisacodyl. This is an oral or rectal stimulant laxative. This is more popular for older kids, but I rated 4 out of 10 because like Colace, it doesn't work immediately. What about the common products that we see over the counter for constipation relief, like Mommy Bliss or Wellmint? So I'm going to cover some of the most common ones. Mommy Bliss Baby Constipation Ease. This is a product that contains herbal liquids with fennel and dandelion that is used in traditional herbal medicine to promote healthy gut function. It also has a small amount of magnesium, which is thought to be that element that helps relax tense bowel muscles. So I rate this 7 out of 10 because it may work well in some babies and is fairly gentle because it has some solid natural ingredients in it. Now, Poo Motion, this is a product that contains natural fibrous roots like marshmallow root, and it acts likely as an osmotic agent. It pulls water into the intestine and giving stools form and bulk to be propelled through the intestinal tract. I rate this 4 out of 10 because it's not clear if all kids will respond well to these natural fibers because it can cause side effects like gasiness. Wellmint contains prune juice concentrate and chicory root. The idea is that it contains fibers that can promote healthy bowel movements, but I honestly wouldn't recommend it as an effective remedy. Rated 3 out of 10. Wellmint contain prune juice concentrate and chicory root. The idea is that it contains some sugar and prebiotics and fiber that can promote healthy bowel movements, but I honestly wouldn't recommend it as an effective remedy. Rated 3 out of 10 because it doesn't always work for kids and it really depends on the child. Thank you for tuning in. If you made it this far, and if there are any other products you're wanting me to review for treating constipation in kids, please leave it in the comment below. I would be happy to give you my honest, unbiased, professional opinion. There are just so many products and new ones hit the shelves every month. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule time to chat. Thank you all for watching and see you next time as we navigate the world of holistic pediatric medicine.